Did you know that the normal blood pressure number you've heard for years might not be the safest one for older adults? As we age, our bodies change, and so does what's considered healthy. Blood pressure that's too high can lead to heart attacks or strokes, but blood pressure that's too low can cause dangerous falls. So what's the right balance? Today, we'll explore an important question. What's the safest blood pressure for older adults? I'm Dr. Mark, and welcome to Dr. Mark Official. With 10 years of experience, I'm here to share trusted advice to help you live healthier every day in simple ways. Today, I would like to talk about an important health topic. What's the safest blood pressure for older adults? Blood pressure is one of the most important health indicators, especially for older adults. As people age, their bodies undergo many changes, including changes in the cardiovascular system. The arteries may become stiffer and narrower over time, making it harder for the heart to pump blood efficiently throughout the body. This is why monitoring and maintaining healthy blood pressure levels becomes increasingly critical as people grow older. Blood pressure is measured using two numbers. The top number, known as systolic pressure, measures the force of blood against artery walls when the heart beats. The bottom number, known as diastolic pressure, measures the force when the heart is at rest between beats. A normal reading is generally considered to be around 120/80. When these numbers consistently go above or below the healthy range, it can lead to serious health consequences. High blood pressure, also known as hypertension, is one of the most common health problems among older adults. When blood pressure remains elevated for a long period of time, it puts excessive strain on the walls of the arteries. Over time, this constant pressure can damage and weaken the arteries, making them less flexible and more prone to blockages. This significantly increases the risk of developing heart disease, which is one of the leading causes of death among older populations worldwide. Furthermore, high blood pressure is a major contributing factor to stroke. When the arteries supplying blood to the brain become blocked or burst due to excessive pressure, it can result in a stroke. A stroke can cause permanent brain damage, loss of speech, paralysis, and in severe cases, death. The risk of stroke increases dramatically when blood pressure is not properly controlled, making it absolutely essential for older adults to keep their blood pressure within a safe range. Kidney problems are another serious consequence of uncontrolled high blood pressure. The kidneys rely on healthy blood vessels to filter waste and excess fluids from the body. When high blood pressure damages the blood vessels in the kidneys, their ability to function properly decreases over time. This can eventually lead to chronic kidney disease or even kidney failure, requiring dialysis or other medical interventions. On the other hand, very low blood pressure, known as hypotension, also poses significant risks for older adults. When blood pressure drops too low, the brain and other vital organs may not receive enough blood and oxygen to function properly. This can cause symptoms such as dizziness, lightheadedness, blurred vision, and sudden weakness. For older adults, these symptoms are particularly dangerous because they greatly increase the risk of falling. Falls are a leading cause of serious injury among older adults, often resulting in broken bones, head injuries, and long recovery periods. A fall caused by low blood pressure can dramatically reduce an older adult's independence and quality of life. Therefore, it is just as important to prevent blood pressure from dropping too low as it is to prevent it from rising too high. Careful monitoring and regular medical checkups are essential steps in protecting the health and well-being of older adults. When it comes to blood pressure management, one of the most important things to understand is that there is no single perfect number that applies to every person. While general guidelines provide a helpful starting point, the safest blood pressure level for any individual depends on a wide range of personal health factors and medical conditions. This is especially true for older adults, whose health profiles tend to be more complex and varied compared to younger individuals. For many years, the standard recommendation was to keep blood pressure below 120/80 for all adults. However, medical research and clinical experience have shown that this one-size-fits-all approach does not always work, particularly for older people. What may be considered a healthy blood pressure level for one person could actually be harmful for another. This is why healthcare professionals today take a much more personalized approach when determining safe blood pressure targets for their patients. One of the key factors that influences the ideal blood pressure target is a person's age. As people get older, their bodies change in ways that affect how blood pressure should be managed. For instance, older adults often have stiffer arteries, which means their blood pressure readings may naturally be higher than those of younger adults. Aggressively lowering blood pressure in these individuals without considering their overall condition could do more harm than good. Existing medical conditions also play a significant role in determining the safest blood pressure level. For example, a person with diabetes may require a different blood pressure target compared to someone without diabetes. Diabetes can affect the blood vessels and kidneys, making careful blood pressure management even more important. Similarly, individuals with chronic kidney disease, heart failure, or a history of stroke may need specific blood pressure targets tailored to their unique health needs. The medications a person is taking can also influence what blood pressure level is considered safe. Some medications used to treat other conditions can raise or lower blood pressure as a side effect. When multiple medications are taken together, known as polypharmacy, the interactions between them can make blood pressure management more complicated. Doctors must carefully evaluate all medications a patient is taking before setting a blood pressure target. A person's lifestyle and daily habits are equally important considerations. Factors such as diet, physical activity level, smoking, alcohol consumption, and stress levels all have a direct impact on blood pressure. Two people with the same age and medical history may have very different blood pressure needs based on how they live their daily lives. Mental health is another often overlooked factor. Conditions such as anxiety and depression can affect blood pressure readings and overall cardiovascular health. A truly personalized approach to blood pressure management must take mental and emotional well-being into account as well. Ultimately, determining the safest blood pressure level requires open and ongoing communication between the patient and their healthcare provider. Regular monitoring, honest discussions about symptoms and lifestyle, and periodic adjustments to treatment plans are all necessary to ensure that each individual receives the most appropriate and effective care possible. When discussing blood pressure goals for older adults, many health professionals suggest a general target range rather than a strict number. In recent years, research has shown that keeping systolic blood pressure, the top number in a reading, below 130, can significantly reduce the risk of heart attacks, strokes, and other cardiovascular problems in healthy older adults. This recommendation is often given to individuals who are active, independent, and do not have multiple serious medical conditions. For these individuals, maintaining a systolic pressure under 130 can provide strong protection against long-term damage to the heart and blood vessels. Systolic blood pressure measures the force of blood pushing against artery walls when the heart beats. As people age, this number tends to rise because arteries naturally become stiffer and less flexible. This stiffening makes it harder for blood to flow smoothly, causing the heart to work harder. By aiming for a systolic level below 130, doctors hope to reduce the strain on the heart and lower the risk of complications related to high blood pressure. However, while a target below 130 may be ideal for many healthy older adults, it is not always the safest option for everyone. In some cases, aiming for a slightly higher target, such as below 140, may be more appropriate. This is particularly true for older adults who have multiple chronic conditions, frailty, or a higher risk of falls. Lowering blood pressure too aggressively in these individuals can sometimes lead to side effects such as dizziness, weakness, confusion, or fainting. These side effects are especially concerning because they increase the risk of falls, which can result in serious injuries like hip fractures or head trauma. For an older adult, a fall can lead to long hospital stays, loss of independence, and a decline in overall quality of life. In such situations, maintaining a systolic blood pressure under 140 may provide a better balance between reducing cardiovascular risk and preventing harmful side effects. The choice between a target of below 130 or below 140 often depends on how well a person tolerates blood pressure medications. Some individuals respond well to treatment and experience no significant symptoms even at lower readings. Others may feel unwell when their blood pressure drops too much. Doctors carefully monitor how patients feel, not just what the numbers show, before deciding on the most appropriate target. It is also important to consider life expectancy and personal health goals. For a very active older adult with many healthy years ahead, aiming for a lower target may offer long-term benefits. For someone with serious health conditions or limited mobility, a slightly higher target may be safer and more realistic. Ultimately, the general target range serves as a guideline rather than a strict rule. The goal is to reduce the risk of heart disease and stroke while ensuring that the individual feels stable, safe, and able to maintain daily activities comfortably. Personalized medical advice plays a crucial role in managing blood pressure, especially in older adults. While general guidelines provide helpful recommendations, doctors understand that each patient is unique. Before setting a specific blood pressure target, healthcare providers carefully evaluate several important factors, including age, current medications, risk of falls, and existing chronic illnesses. This individualized approach ensures that treatment plans are both safe and effective. Age is one of the first considerations. As people grow older, their bodies respond differently to medications and changes in blood pressure. Arteries naturally become less flexible over time, which can cause systolic blood pressure to rise. At the same time, older adults may be more sensitive to sudden drops in blood pressure. A reading that might be perfectly safe for a younger person could cause dizziness or weakness in someone much older. Doctors take this into account when determining how aggressively to lower blood pressure. Medications are another major factor. Many older adults take multiple prescriptions for different health conditions, such as diabetes, arthritis, heart disease, or high cholesterol. Some of these medications can interact with blood pressure drugs or affect how the body regulates blood pressure. For example, certain medications may increase the risk of dehydration, which can lower blood pressure too much. Others may amplify the effects of blood pressure medicine, leading to symptoms like fatigue or lightheadedness. Physicians must carefully review all medications to avoid harmful interactions and ensure that the treatment plan is balanced. The risk of falls is also a serious concern. Falls are one of the leading causes of injury among older adults, and blood pressure management plays a role in preventing them. If blood pressure drops too low, especially when standing up quickly, it can cause a sudden feeling of dizziness known as orthostatic hypotension. This can lead to loss of balance and falling. When a patient already has mobility issues, poor vision, or a history of previous falls, doctors may choose a more moderate blood pressure target to reduce this risk. Chronic illnesses further complicate blood pressure management. Conditions such as diabetes, kidney disease, heart failure, or a history of stroke require special attention. For example, someone with kidney disease may need tighter blood pressure control to prevent further damage. On the other hand, a person with advanced heart failure may require a more cautious approach to avoid worsening symptoms. Each condition influences how the body handles blood pressure changes and medications. Doctors also consider the patient's overall physical and mental health, level of independence, and personal preferences. Some older adults prioritize maintaining energy and daily functioning, while others focus on long-term prevention of cardiovascular events. Open communication between the patient and healthcare provider allows treatment goals to align with the individual's values and lifestyle. By considering all these factors together, doctors create a personalized plan that aims to protect the heart and brain while minimizing side effects and risks. This thoughtful, patient-centered approach helps ensure that blood pressure management supports both safety and quality of life. Healthy lifestyle habits play a powerful role in managing blood pressure, especially for older adults. While medications are often necessary, daily habits can greatly influence how well blood pressure is controlled. Simple and consistent lifestyle choices can reduce the need for higher doses of medication, prevent complications, and improve overall quality of life. Eating a balanced diet is one of the most effective ways to support healthy blood pressure. A diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy products provides essential nutrients such as potassium, magnesium, and fiber. These nutrients help regulate blood pressure by supporting proper heart and blood vessel function. Potassium, in particular, helps balance the effects of sodium in the body and reduces tension in blood vessel walls. Choosing fresh, natural foods instead of processed items also limits unhealthy fats and added sugars, which can contribute to heart disease and weight gain. Reducing salt intake is especially important for controlling blood pressure. Sodium causes the body to retain water, which increases the volume of blood and raises pressure on artery walls. Many processed and packaged foods contain high levels of hidden salt, including canned soups, snacks, frozen meals, and fast food. By cooking at home, reading food labels carefully, and seasoning meals with herbs and spices instead of salt, older adults can significantly lower their sodium intake. Even small reductions in salt consumption can lead to noticeable improvements in blood pressure levels. Regular physical activity is another key factor. Exercise strengthens the heart, allowing it to pump blood more efficiently with less effort. When the heart works more efficiently, the force on the arteries decreases, which helps lower blood pressure. Activities such as walking, swimming, cycling, or gentle aerobic exercises are often suitable for older adults. Even light activities like gardening or stretching can make a positive difference when done consistently. Engaging in at least 30 minutes of moderate activity most days of the week can improve cardiovascular health, maintain a healthy weight, and boost overall well-being. Managing stress is equally important. Chronic stress can cause temporary spikes in blood pressure and may contribute to long-term hypertension. Stress often leads to unhealthy coping habits such as overeating, smoking, or lack of sleep, which further affect heart health. Relaxation techniques such as deep breathing exercises, meditation, prayer, yoga, or spending time in nature can help calm the mind and reduce tension. Maintaining social connections with family and friends also provides emotional support and reduces feelings of isolation, which can positively impact blood pressure. Taking medications properly is the final but essential part of healthy blood pressure management. Prescribed medications must be taken exactly as directed without skipping doses. Some people may stop taking medication when they feel better, but high blood pressure often has no obvious symptoms. Regular monitoring at home and routine medical checkups help ensure that treatment remains effective. By combining healthy eating, reduced salt intake, regular exercise, stress management, and proper medication use, older adults can maintain safer blood pressure levels and support long-term heart health. Thank you for joining me on Dr. Mark Official as we explored what's the safest blood pressure for older adults. Remember, the safest number is the one tailored to your health needs. Stay informed, stay healthy, and see you in the next video.